Right.
On that point of birth control, what are you saying to your daughters that wasn't said to you? Because Mel regrets, my girlfriend, she's very open, she regrets being on the birth control pill for 10 years because she had no idea what it was doing to her body. And then obviously when she came off her cycle, I think she spent, like you, Natalie, 2 years trying to figure out what was going on, and she didn't have her period for an extended period of time after she came off. What are you saying to your daughters about the birth control pill that wasn't said to you? Are you recommending them to use it how you guys used it, or?
I mean, we were started on it so young. I do see a trend towards not starting it as young as it was started in our generation. And I think that is important. I see, personally, my daughter is not quite at that stage yet. So we haven't had to make these decisions as they have had to. But I do think it's important. Cycle awareness is one of the few early signs you have of your body's health as a young woman. And so to purposefully never get to know what that is a detriment to saying I'm aware of what's healthy for me and I know what's happening in my body. But you guys have had these discussions at different time periods.
For my youngest daughter, I was worried about, she was a dancer also. She was teeny tiny, so tiny, even though she had great muscle mass, but she, like me, wasn't having periods. And so the advice was to put her on birth control to regulate periods. But I was always uncomfortable with that because to be a dancer, she didn't have to be quite as tiny as she was. And so what we've done now is I've encouraged her to gain a little weight and get a little bit more body fat. Because I took her off of that, she only had to gain 5 pounds, I think I said to you, maybe 7. And it has more regulated her, and she's having her own periods now. And so I don't know what she's going to decide. She's going to be 18 soon. But I think what we should be telling our daughters is all the information so that they can make an educated decision. Because I just did what I was told. And I'm a doctor, but I'm not an OB, so I don't understand the nuances of what the pill is, that it's synthetic, that this is how it works, this is what it doesn't do. So I would want to give my daughters all the information so that they can make an educated decision.
So my oldest, the first one coming through, wanted it for contraception. And so when we talk about contraception, it's not just, most people automatically think the oral birth control pill. But I did go through all of the options with her and then sent her to a trusted friend to let her go and make her own decision. And she decided to have an IUD inserted, which I thought was a great choice for her because she had normal, regular periods before we did this. There were no issues. And she had it inserted, and then within a week, she started having severe cramping, called me into the bathroom. And this is my daughter who has not let me see her unclothed since she was 7 years old. She's just very private, and she's like writhing.